everyone. Welcome to our February 2025 Ask the Expert interview series. Today is going to be a little different than normal. Today we are going to do a quick little tour and interview with Dr. Andrea Smith-Gray with our low vision clinic. As most of you know, KLEF opened our low vision clinic back in November of 2024. And this February marks Low Vision Awareness Month. So we want to take some time to talk with Dr. Andrea Smith-Gray about low vision, what it means, and what she does at our low vision clinic. So without further ado, we will dive into our interview with Dr. Andrea Smith-Gray. Hope everyone enjoys and have a wonderful afternoon.
So low vision exams are different than what you normally expect when you go to see the eye doctor. You're not here to get your eyes dilated. What we do is focus on what vision you have and what we can do to make it better. So the exams are longer. They're typically about an hour and a half, and I will take various different measurements of your vision, not just how well you see the eye chart, but also measurements of your color vision, how your contrast is, and where your blind spots are, to really put together an individualized plan for what devices or tools can help you achieve your independence. So some examples here, we have several different magnifiers, high-powered reading glasses, electronic magnifiers, telescopes. They even make telescopes that are called bioptics that fit in your glasses themselves. So those are all things that we take a look at when patients come to our clinic. So during a low vision exam, one thing I do is check the glasses prescription and make sure it's the most accurate. So if we do find a change, I will give the patient an updated glasses prescription that they can take back to their primary eye clinic and fill those there. Sometimes even changing things like their bifocal power or changing the style of that might be the only change that we're making. But those are things that you can take to your typical optician and get those filled. Other things that I might recommend is different magnifiers, and those things are available for purchase, so we can order them for the patients and have them mailed directly to their home if they're interested. And it's all about what the patient wants and what they feel will help them the most. So I might recommend 3 devices, but then you might say, oh, I just want this one right now. That's okay. We'll always have our list of what works best for you. And sometimes just trying out 1 or 2 things at first, you might find that they meet your needs more than you anticipated. And then for some patients, they might need more training than what we do here in the clinic. So there are services for independent living that helps patients learn to manage their household, cooking, laundry, cleaning, those types of things with the devices that they get from the clinic here. And they learn tips and tricks to just make things easier around their home. So those are some services that we refer for. There are services available for local patients at the McDowell Center here. For folks that are out of state, we also can connect them with the organizations in their state. Another really good resource that I love referring for is vocational rehab. So it's a group that will work with you to help identify tools that can work for you to maintain your job. And you know, some people end up having to go on disability, and that's okay, but some people are still working and they want to keep doing that. So if that's a goal, that's typically something that I also refer to. So some of the examples of the equipment we have here is we have several different handheld magnifiers, all sorts of powers. You name the power, we have it, even if it's crazy high. And we have what's called stand magnifiers that lay flat on the page. We have different types of telescopes to help see the television better. And then we also have our electronic magnifiers that we keep that have different sizes, different features to really help find the one that works best for you if that's what we need to ultimately go to. And the goal really really is to find tools that match up with what the patient is having difficulty with. So if it's sewing, we can look at some hands-free options. If it's reading the mail, we might be looking at handheld magnifiers. So it's really pinpointing what difficulties folks are having during the day because of their vision, and what types of tools can we connect them with that help them achieve those goals. So one of the aspects that we focus on in the low vision clinic is also lighting. Different types of lighting and different placement of lighting can be very helpful to see different things. Having low vision, it's really common to have a lot more light sensitivity than when you were normally sighted. And so another thing that we do here at the clinic is a tint assessment. So I believe I have every tint known to mankind here, but if outdoor glare is the issue, oftentimes on a sunny day, which we haven't had too many, I'll take the patient outside and we'll assess what tint really helps you the most when you're outside. Same thing with inside. Sometimes having different tint for when you go into a bright grocery store can be helpful to cut down on glare. So these are all things that many people don't think about, but little changes that can make a big difference. So one thing I really love about low vision exams is we're looking at more than just what someone can see on an eye chart. It's really about the individual person. And low vision is also often referred to as low vision rehabilitation. And the reason being, there's different providers that might get involved, but everything is really specialized for the individual patient that comes in here, because not everyone has the same goals and not everyone has the same vision. So a good portion of the exam, we're really talking about things that you're having difficulty with at home, reading difficulties, what's your day-to-day like during your normal day, what kind of things frustrate you because of your vision, and what kind of things would you like to do better that your vision is getting in the way of. And so it's good to come to the clinic having an idea of your goals, some things that you want to be able to do, because the exam is very goal oriented. And so that's helpful when you come to the clinic to know those things in advance, but even if you don't, we'll kind of talk through every different avenue to really match you with the perfect device to meet your goal. So if you feel you'd benefit from a low vision exam, or you have a family member or loved one that you feel would benefit from an exam, you can go to our website. It has our contact information on there. One requirement for the clinic is that you do have a recent eye exam, because we're not dilating the eyes and taking a look at the health. We're managing the function of your vision. So that information helps me see what kind of treatments you've had, where your vision's at, and what your optometrist or ophthalmologist is planning in terms of your treatment for your eye conditions. So if you have those records, you can self-refer on the website. If you don't, it's also a place where other providers can refer patients to us, and they can connect us with the information that we need to schedule your appointment.